My name's Michelle Wetzel, and I am an IT analyst for Ozarks Healthcare. My role is I take care of the people that take care of my patients. I'm proud that this hospital is still here. You know, after 50 some years, a lot of hospitals, especially little rural hospitals, have gone by the wayside, or they've been bought out by bigger hospitals, and we are still independently owned. My biggest accomplishment, I really feel like, is access eForms and getting them up and going and learning myself how did they work and then being able to train other people on them and make their life a little easier. You know, if you can save them 2 or 3 steps per patient, then that's huge by the end of the day.
So my name is Dwayne Cook. I'm the patient access manager, and I have been here 9 years. So before access, we used paper consents, paper PHI forms, everything was paper. And so we were ordering new forms on a bi-weekly basis, and we would order boxes of paper. I would say we're probably saving 5 minutes per registration now. With the e-signatures, we just have to scan a barcode. We hand them the iPad. They read through the consent forms and all the documentation. They sign off on it, and it's right there in their account. It automatically stamps the identifiers. It pretty much does everything for us.
My name is Buffy Kamari. I'm the supervisor of medical records. I've been here at OZH for 21 years. For our department, it means that the patient information is automatically added onto the chart. We get the patient's name, their date of birth, their date of service, the account number that it goes on. Then too, when the patient signs it, it's automatically dated and timed. And then when the witness signs it, it's automatically dated and timed. And it's legible.
So my name is Tiffany Dale, and I have been with Ozarks Healthcare for 13 years now. I am their clinic supervisor, and that has been my sole role the whole time I've been here. Now the patient comes into the office. We pull up their any kind of paperwork that they have to do. We hand them a, laptop, or we hand them an iPad. You sign right here. They sign it. Patients love the iPad signatures, and this is the reason why. They don't have to flip through the pages. They are, and even the elderly even love this, because they're not having to sit down and go into rigorous, paperwork that they have to sign, and then having to bring it back up to the girls in the front. And, the e-access forms are great because my front office staff do not have to scan those into the chart. And so that saves time for them. It saves time of, okay, did we scan this in the correct chart? Because they go automatically into that chart. I really, really do think that, it's a great asset to the clinic here.
Everybody now that is either a clinic or our outpatient department or the hospital, we are all now on MEDITECH Expanse. So now it automatically launches from MEDITECH, and it just opens to a screen right in front of MEDITECH. It pulls all of our consents up that we have. It's been great because we've got them actually. We've made packets, so I've got like an ER packet, so the forms that the ER would use, that's what they would pull up. We've got clinic forms, which the clinics will use, and then we just have individual forms, so if they need something extra, then they can just pull it at the time that they check them in, and it's been great. We
are neighbors caring for neighbors. That means that when you walk through that door, we're going to treat you like a family member. I mean, we serve our neighbors. I mean, we serve our family and our friends. We're a close-knit community. Everybody knows everybody here, and so it really is neighbors caring for neighbors. We don't have to leave Expanse to go into access the forms, the consent forms. As soon as we're done registering in Expanse, it shoots up that barcode, pulls up that barcode, we can scan that barcode, and then patients are able to sign the consent forms. And like I said, it saved 5 minutes off of each registration. Whereas if we had to go outside of Expanse, go to a separate website, pull up all the consent forms on a separate website, have them sign that, and then somehow take that and put it back into Expanse, that wouldn't save us any time.